Okay, let's go into some operational definitions before we continue. Opioid use disorder is a problematic pattern of opioid uses that causes significant impairment or distress. A diagnosis is based on specific criteria, such as unsuccessful efforts to cut down or control use, or resulting in social problems and a failure to fulfill obligations at work, school, or home, among other criteria. Opioid use disorder is referred over other terms with similar definitions, known as opioid addiction or opioid abuse. Release to the community. The release to the community means that an offender is released from a commitment order to a juvenile or adult state correctional facility or from a county jail after completing a sentence or disposition of confinement, or when an offender is released into the community following sentence or disposition to the community. Continuing with medication assisted treatment, that is also known as MAT. It is the use of medications in combination with counseling and behavioral therapies, which is effective in the treatment of opioid use disorders and can help some people sustain recovery. I will go into some of those medications as we move forward. Cognitive behavioral intervention is a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and severe mental illness. Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated to be as effective as, or more effective than, other forms of psychological therapy or psychiatric medications. Opioid overdose is the injury to the body that happens when a drug is taken in excessive amounts. An overdose can be fatal or non-fatal. And we end with recidivism, the tendency of a convicted criminal to reoffend.